Hello, everyone, and welcome you all to yet another Facebook Live talk. Today, we have Dr. Annagha Chope, who is a senior oncoplastic surgeon. So, you must be wondering, why do we have an oncoplastic surgeon today for this conversation for those who are new or who have not seen the invite? So, October is celebrated as Breast Cancer Awareness Month all across the world. इंडिया में भी ब्रेस्ट कैंसर अवेयरनेस के जो केसेस हैं अमंग इंडियन फीमेल्स वो बढ़ रहे हैं फॉलोड बाय सर्विकल कैंसर सो कैंसर में अर्ली डिटेक्शन या अर्ली स्टेज पे पता चलना वो सर्वाइवल रेट के लिए बहुत इम्पॉर्टेंट है और इसीलिए आज का कॉन्वर्जेशन हम डॉक्टर अन्नगा के साथ करेंगे उनका मैं थोड़ा सा आपको इंट्रोडक्शन दे दूं. So, Dr. Annaga Zope is a senior breast oncoplastic surgeon at Apollo CVCC Cancer Care, Ahmedabad. She has over 24 years of experience, a very exemplary surgical experience, and she is an exclusive breast oncoplastic surgeon. She is having an extensive practice as well as experience in treating breast cancer. She has pioneered the establishment of multidisciplinary breast cancer management and oncoplastic breast surgery at the Apollo CBCC Cancer Care and Apollo Hospitals International Limited in Ahmedabad. So, thank you so much, Doctor, for sparing your time, from taking time off from your practice, from a very busy practice, and sharing it with us today. And we'll make sure that we take umpteen advantage of your time by getting nuggets of your wisdom in this talk.
Thank you so much, Kritika. And at the very outset, let me express my thanks to Mania and yourself for giving me this opportunity to interact with your audience. And I guess let's make the best of this opportunity.
Thank you, ma'am. Thank you so much. So, ma'am, my first and foremost question will be, why breast cancer awareness is extremely important for women or for any individual these days?
Uh, a very good question, which requires a long answer. Quite a few points. The first thing, first and foremost, breast cancer is on the rise in our country just as it is in the other countries of this world. Breast cancer is occurring in more and more younger women in our countries. And unfortunately, though we have very good resources for management of breast cancer, we are still seeing more than 50 to 60% of our women coming with advanced stages of breast cancer where treating it becomes a little difficult. And the most foremost reason why every person, every woman, every family should be aware of breast cancer and how to prevent it, how to diagnose it is because as of today, there is no preventive measure available to us which we can adopt and say that now I won't get breast cancer. So, the best weapon in our hands is early diagnosis. We stay aware about the disease, we diagnose the disease early, and we stay alive from the disease.
Right. All right. Valid point. So, uh, what are those risk factors? Like, okay, it is important, but now we go on to this phase where we have established the importance of knowing about breast cancer. How do we do that? So, let's start with the risk factors. ऐसे क्या रिस्क फैक्टर्स हैं या ऐसी क्या चीज़ें हैं जो आपको ब्रेस्ट कैंसर से अफेक्टेड होने में सबसे ज़्यादा मतलब आपको वल्नरेबल बनाता है या आपके चांसेस ज़्यादा है कि आपको ये ब्रेस्ट कैंसर हो सकता है. तो ऐसी क्या चीज़ें हैं जिसकी वजह से आपको ब्रेस्ट कैंसर होने के चांसेस ज़्यादा हैं.
तो अगर हम मेडिकल एक टर्मिनोलॉजी यूज करें तो ब्रेस्ट कैंसर एक मल्टीफैक्टोरियल डिजीज है. इसका मतलब ये है कि किसी भी महिला में या इवन पुरुष में ब्रेस्ट कैंसर होने की जो रिस्क है ये कई सारे फैक्टर्स पर डिपेंडेंट होती है और आपकी केस में इनमें से कितने रिस्क फैक्टर्स एक्टिव है विल डिसाइड कि आपकी अपनी पर्सनल या वैयक्तिक जो जोखम होती है या पर्सनल रिस्क जिसको कहते हो गेटिंग ब्रेस्ट कैंसर कितनी हाई या लो है. It is very important to understand about these risks individually. It is also very important to understand which of these risks are controllable and which are not. Because of the simple reason that if you can reduce the intensity of the controllable risk factors, then your overall risk of getting breast cancer will reduce. So it is extremely
Right.
important to understand what are the risk factors, what category are they, and how many of you them are existent in your personal case. So अगर हम रिस्क फैक्टर्स की बात करें तो सबसे पहला रिस्क या सबसे पहला जिसको जोखिम कहते हैं वो है कि आप एक स्त्री हैं। महिलाओं में ब्रेस्ट कैंसर होने की रिस्क सबसे ज़्यादा है। पुरुषों में भी ब्रेस्ट कैंसर होता है पर उसकी इंसिडेंस काफ़ी कम होती है। अमूमन हम
Okay.
जब हमारी प्रैक्टिस में 100 महिलाओं को ब्रेस्ट कैंसर के साथ डायग्नोस करते हैं, तब जाकर एक आध पुरुष में ब्रेस्ट कैंसर देखा जाता है। So the first and foremost thing that you are a woman, you are at a high risk of getting breast cancer. एंड इसका एक सिंपल सा रीज़न ये है कि महिलाओं में जो हार्मोनल चेंजेस होते हैं बॉडी में, ये काफ़ी लंबे समय तक होते रहते हैं। फ्रॉम द टाइम दैट आपका पीरियड शुरू होता है से लेके जब तक आपका पीरियड ख़त्म नहीं होता, ये चेंजेस हर महीने के अलग-अलग ड्यूरेशन में आपके बॉडी में होते रहते हैं और इसके इफ़ेक्ट्स जो है आपके ब्रेस्ट पर भी देखे जाते हैं। The
All right.
second risk factor which is quite significant is बढ़ती उम्र। जैसे जैसे
Okay.
आपकी एज बढ़ती जाती है वैसे वैसे ब्रेस्ट कैंसर की रिस्क बढ़ती जाती है। हमारे देश में सबसे ज़्यादा ब्रेस्ट कैंसर के केसेस 40 से लेके 50 के एज ग्रुप में देखे जाते हैं आजकल। लेकिन इसका मतलब ये नहीं है कि आज अगर मेरा 50th बर्थडे है तो मैं आप सबके एक पार्टी दे दूँ कि भैया आज तक नहीं हुआ अब नहीं होगा। बिल्कुल नहीं, जैसे-जैसे आपकी एज बढ़ती जाएगी आपके ब्रेस्ट कैंसर होने की रिस्क भी बढ़ती है। इसके सिवाय
Right.
जो है कई सारे फैक्टर्स ऐसे होते हैं, ये जो 2 फैक्टर्स हैं ये कंट्रोलेबल नहीं है। You cannot help it that you are a woman, you cannot help it that your age is
Yeah.
increasing. Similarly, you cannot help that you were born with a particular family history. अगर आपकी फैमिली में किसी के ब्रेस्ट कैंसर की, ओवेरियन कैंसर की, प्रोस्टेट कैंसर की या 1-2 और ऐसे कैंसर्स होते हैं कि जिनके होने की रिस्क है या उनकी इंसिडेंस है, तो देन आपकी अपनी इंडिविजुअल रिस्क ऑफ गेटिंग ब्रेस्ट कैंसर इंक्रीजेस, स्पेशली इफ these cancers have occurred in your first degree relatives. Your first degree relatives means your mother, your sister, your daughter. These are first degree. Second degree will be your grandmothers, your maternal, your paternal. कई सारे लोग ऐसा मानते हैं कि ब्रेस्ट कैंसर सिर्फ मदर की साइड से आ सकता है। बिल्कुल नहीं, ब्रेस्ट कैंसर किसी भी साइड से आ सकता है एंड द फैमिली हिस्ट्री ऑन बोथ द साइड्स इज इक्वली सिग्निफिकेंट. Even on your father's side, if anybody had breast, ovarian or prostate cancer, that is a significant history. फादर को, ब्रदर को या सन को ब्रेस्ट कैंसर होना या प्रोस्टेट कैंसर होना ये भी एक सिग्निफिकेंट हिस्ट्री। इसके सिवाय जो हम सोचते हैं कि और ऐसे कौन से फैक्टर्स हैं कि जो मेरे कंट्रोल में नहीं है। सो द फर्स्ट एंड फॉरमोस्ट थिंग इज क्या आपकी फैमिली में किसी तरह का जेनेटिक म्यूटेशन पाया गया है which puts you at a higher risk of getting breast cancer. The commonest is BRCA1 and BRCA2 mutations. इसके सिवाय
Okay.
कई सारी महिलाओं की पीरियड्स की जो शुरू होने की डेट होती है, एज होती है और खत्म होने की एज होती है, ये अलग होती है हर एक में। वो महिलाएं जिनके पीरियड्स बहुत यंगर एज में शुरू हुए हैं और बहुत लंबे अरसे तक चलते रहे हैं, सो दैट means your menarche was at a younger age and your menopause is at a later age. They are at a higher risk of breast cancer, unfortunately, because they are exposed to that longer duration of their menstrual period, right?
Right.
जिन महिलाओं को ड्यू टू व्हाटएवर मेडिकल रीजंस कभी प्रेगनेंसी नहीं रह पाई, who can could not conceive and have a full time pregnancy, full term pregnancy, is they are at a high risk of breast cancer. Those women, due to whatever medical reason, who couldn't breastfeed their children have a higher risk of getting breast cancer. So these are the risk factors which are considered to be not controllable by yourself. अगर ये हैं तो ये एक बेसिक बेसलाइन आपका हाई रिस्क बना देता है। अब कई सारे ऐसे फैक्टर्स हैं जो आपको ब्रेस्ट कैंसर के हाई रिस्क कैटेगरी में डालते हैं, जो बिल्कुल आपके हाथ में है। और इसमें से एक जो हमने जिस तरह से डिस्क्राइब किया कि जो महिलाएं फर्स्ट प्रेगनेंसी डिले करती हैं या जो महिलाएं अपने बच्चों को ब्रेस्ट फीड करना नहीं चाहती हैं, तो इनकी जो है ब्रेस्ट कैंसर की रिस्क बढ़ जाती है। So if you plan your pregnancy at a right age and don't delay your first pregnancy, that can help you in reducing your breast cancer risk. Breastfeeding your child will give you a protection or will reduce the risk of getting breast cancer. इसके सिवाय जो हमारे सर्टेन लाइफस्टाइल रिलेटेड चेंजेस हैं, जैसे कभी एक्सरसाइज ना करना, आपका जो है स्पेशली मेनोपॉज के आसपास मोटापा रहना या ओबेसिटी रहना, पेरीमेनोपॉजल ओबेसिटी को बोलते हैं, या आपकी जो ईटिंग हैबिट्स हैं, इफ योर ईटिंग हैबिट्स आर नॉट हेल्दी, इफ यू टेक अ लॉट ऑफ हाई कैलोरी डाइट, अ लॉट ऑफ जंक फूड with a lot of use of refined products, that puts you at a higher risk of getting breast cancer. So what effectively happens is all this predisposes you towards a weight gain situation, a obesity situation, a situation where your metabolic rate goes down and hence your risk of getting breast cancer increases. इसके सिवाय कंट्रोलेबल फैक्टर्स में एक बहुत सिग्निफिकेंट फैक्टर है जिसको कहा जाता है हार्मोन रिप्लेसमेंट थेरेपी. Hormone
Okay.
replacement therapy is not your any other hormonal tablets which you receive, like your thyroid medications or medications for your diabetes. These are not hormone replacement therapy. हार्मोन रिप्लेसमेंट थेरेपी एक यूनिक टाइप की ट्रीटमेंट होती है जिसमें हाई डोज ईस्ट्रोजन के डोसेजेस आपको दिए जाते हैं अराउंड मेनोपॉज टू कंट्रोल सम ऑफ द बैड effects of menopause. Most of
Okay.
the time, these are given by gynecologists to handle menopausal मेडिकल कॉम्प्लिकेशंस. कई सारी महिलाओं को मेनोपॉज के दरमियान बहुत सिवियर मेडिकल कॉम्प्लिकेशंस होते हैं रिलेटेड टू देयर बोन्स और देयर हार्ट. दैट इज व्हेन दे आर एडवाइज दिस. बट कई सारी महिलाएं जिनको other social या psychosocial side effects होते हैं related to menopause, they also like to take hormone replacement therapy so that they don't have to encounter these. So here they have to be very careful in understanding that hormone replacement therapy will put you at a higher risk of breast cancer. So God forbid, if
Okay.
you have to take hormone replacement therapy, it should be under medical advice, under medical supervision. और जब तक आपका हार्मोन रिप्लेसमेंट थेरेपी चल रहा है तब तक हर 6 मंथ्स आपको ब्रेस्ट चेक करवाना है. और ये खत्म होने के बाद भी अप टू 5 years you have to regularly check your breast. So that's significant. So now
All
when
right.
you think about all these things, you need to understand that it is a balance between these factors which will define your own personal risk of breast. So if I have a certain factor which is putting me at a high risk, and if I reduce the intensity of a lifestyle related factor, then I will reduce my risk of getting.
All right. All right. So basically, this is combination of जो risk factors हैं या आपने जिसमें starting में word एक use किया जोखिम, which basically इसकी possibility ये चीज़ आपको हो सकती है या नहीं. It's a combination of things which are under your control and things which are not under your control. So whatever is in your control वो ये है आपका ultimately आपका lifestyle और
Absolutely.
आपकी प्रेगनेंसी हैबिट्स या अगर आप कोई हार्मोनल थेरेपीज ले रहे हैं तो वो डेफिनेटली अंडर एक्सपर्ट सुपरविजन अंडर योर डॉक्टर सुपरविजन लेनी है. बाकी जो रिस्क फैक्टर्स हैं विच आर जेनेटिक इन नेचर उसमें हम शायद कुछ ज़्यादा नहीं कर सकते. इट्स व्हाट वी आर ब्लेस्ड विथ or cursed with. That's a
Yes,
different
yes,
way of saying
always.
it. Blessed with. So we can't do much, but lifestyle and the therapies or anything else that you are ingesting in your body in terms of pills, also hormonal pills, that has to be strictly done under a doctor's supervision, not
Absolutely.
like on
They
your
should
own
not be
discretion.
self-prescribed and they should not be taken just because there was no other alternative.
Yes, yes, yes. I think my next question, again moving on, would be symptoms. So यहाँ हमने risk factors समझे, but what about symptoms? कि risk factors हो गया. Symptoms are the indicators कि when am I supposed to get that red flag या कब मुझे चौकन्ना होना है कि अच्छा ये मुझे सिम्टम मेरी बॉडी में दिखा है या ये कोई चेंज मुझे दिखा है और वो चेंज आपको अलर्ट करना चाहिए या वो चेंज अगर आप नोटिस करते हैं अपनी बॉडी में या अपने ब्रेस्ट्स में तो आपको तुरंत जाके डॉक्टर को कंसल्ट करना है या एग्जामिनेशन करवाना है. तो ऐसे वो कौन से लक्षण हैं या सिम्टम्स हैं ब्रेस्ट कैंसर के जिसके लिए हमें हमेशा अलर्ट रहना चाहिए.
So I really like the use of the word red flag that you have done because I always like to tell this, and this is something that all of us have to remember is that we have to become alert before the red flag comes up. We have to try to look for
Right.
breast cancer before the coming of a red flag. Because by the time red flags eye, by the times you have symptoms, it is possible that breast cancer has already advanced to second stage or third stage. Okay.
Right.
So the first and foremost thing is there is a difference in being, looking for breast cancer. There are two different ways. One is what we call as screening for breast cancer, and the second is diagnosis of breast cancer. तो जब आप कोई तकलीफ लेकर डॉक्टर के पास जाते हैं उसको डायग्नोसिस कहते हैं, तो तब आप कौन सी तकलीफ को लेकर जा सकते हैं, विच आर दो सिम्टम्स विच शुड मेक यू अलर्ट दैट देयर कैन बी समथिंग रॉन्ग एंड दिस माइट बी ब्रेस्ट कैंसर. द फर्स्ट एंड फॉरमोस्ट थिंग इज पेनलेस लम्प्स इन योर ब्रेस्ट, जिससे आपको
Okay.
कोई तकलीफ नहीं हो रही है. देर इज अ स्वेलिंग, इट्स अ हार्ड swelling, you are not able to assess why did the swelling come. There's no reason for it, and there's a very hard painless swelling in the breast. There
Okay.
are certain skin changes which are seen in breast cancer, like the nipple of the breast getting pulled inside, जिसको medical terminology में retraction कहा जाता है. The nipple just starts getting inverted inside the breast, and nipple के ऊपर अल्सर होना या छाला होना, nipple में से red color का या blood type fluid आना. These are some of the symptoms of breast cancer that a woman can have. Besides these, there can also be symptoms like swellings in your underarms, because your breast drains into your underarm lymph nodes, जिसको in medical terminology में axillary lymph nodes कहते हैं. So you can
Okay.
even present with a swelling in that part of the breast, the
Well,
underarm.
which is what this part, auxiliary, as it can you
Visualize your
show to our
underarm.
viewers?
Yeah.
Okay. So
जो
it's
आपकी
not just the
बगल
breast, but the areas starting जो आपका
बिल्कुल.
बगल का
हाँ
एरिया
जी,
है आर्म के यहाँ,
हाँ जी,
वहां से
हाँ जी.
स्टार्ट होते.
या बिकॉज आपके ब्रेस्ट का एक पोर्शन बगल की तरफ जाता है, और हर एक हमारे बॉडी के हर एक ऑर्गन को ड्रेनिंग लिम्फ नोड्स होते हैं, विच आर नॉर्मल
Right.
स्ट्रक्चर्स. और किसी भी
Right.
बॉडी के पार्ट में जब कैंसर होता है तो सबसे पहले वो बगल के वो लिम्फ नोड्स में जाता है, और ब्रेस्ट के लिम्फ नोड जो है बगल में होते हैं.
अच्छा.
So these are some of the common symptoms that should alert you that I might be having a problem with my breast and I need to see a doctor.
Right. Right. सो आई थिंक ये जो टॉक सब देख रहे हैं और सुन रहे हैं, ये जो पोर्शन है हमारे कॉन्वर्जेशन का, ये बहुत ज़रूरी है, क्योंकि हमें लगता है कि हम क्या कर सकते हैं, ये तो मतलब डिजीज़ है, होगा, डॉक्टर बताएंगे, वो हम करेंगे. ऑफ कोर्स जो डॉक्टर बताएंगे वो ट्रीटमेंट का पार्ट है, लेकिन जब तक आप शिकायत लेकर सही वक्त पे डॉक्टर के पास नहीं जाएंगे, तब तक आपको कोई हेल्प नहीं कर सकता, राइट? सो ये जो 5-6 पॉइंट्स जो डॉक्टर ने बताए हैं, जैसे निपल रिट्रैक्शन है, या आपको अपने ब्रेस्ट में कोई नए तरीके की कोई डेवलपमेंट दिख रही है या चेंजेस दिख रहे हैं, ऑरेंज स्किन, आई थिंक पील जिसको बोलते हैं, ऑरेंज की पील जैसी ब्रेस्ट की स्किन होना, या रेडनेस दिखना, या आपको किसी तरह का लंप या गांठ महसूस होना, तो जैसे मैम ने कहा, ये सबसे कॉमन लक्षण है, सिम्टम्स हैं और रेड फ्लैग्स हैं कि आपको तुरंत पूछना है, आप तुरंत आपको डॉक्टर से मदद लेनी है. So thank you, ma'am, for shedding light on this part, because I think this is the thing जो सबसे ज़्यादा एक पेशेंट के, एक इंडिविजुअल के हाथ में होती है. मूविंग ऑन टू माय नेक्स्ट क्वेश्चन. पहले ये सुना जाता था कि आपको 40, 45, 50 इयर्स की एज के बाद आपको मैमोग्राफी करवानी चाहिए, या फिर आपको टेस्टिंग करवाना चाहिए. दैट इज़ द पॉइंट व्हेन यू शुड गो टू अ डॉक्टर एंड think, worry about whether you will get breast cancer or you will get diagnosed or not. Nowadays, the trend is that बहुत सारी young लड़कियां, like we have published stories on our O Womania's blog, that we had a 26-year-old breast cancer fighter. I won't call her a survivor, but a fighter. And she was just 26 years old when she was diagnosed. So ये जो अभी जो ट्रेंड दिख रहा है कि यंगर लड़कियां हैं जो 20 late 20s में या early 30s में हैं, they are also getting diagnosed with breast cancer. So there is a little shift that we are observing. So can you tell us why, what are the possible reasons for this shift in the age group, and why younger women are now suffering with breast cancer?
Definitely, we are seeing more and more incidents of breast cancer in younger women today, especially in our country. It is not that we are, breast cancer is now happening only in the younger women. We still are seeing majority of our cases around 40 years of age. However, yes, we
Okay.
are seeing more younger women with breast cancer, and it is a very difficult situation at that point of time because there are a lot of differences that you see not only in the presentation but also in the management. There are some perspectives which are very peculiar to younger women with breast cancer and managing them. Why do we see so many younger women with more breast cancers? One of the reasons probably is the lifestyle related factors that we are finding. These may be responsible for more younger women now presenting with breast cancer as compared to maybe 2 or 3 decades prior that we had been seeing.
Okay. Okay. So again, but aren't there any, my follow-up question to this is that aren't there any lifestyle issues that are actually forcing these women to get breast cancer to early age, or they're just genetic causes?
both both ways.
Both.
Genetic component of breast cancer etiology is not as high as what we would like to believe it. Even in those women who have a family history of breast cancer, not all of them will end up having a genetic mutation. So this is something that all of us need to understand. There are some families which will have more incidence of breast
Okay.
cancer and within their families, but they may not have an identifiable mutation. So what is a mutation? All of us have cell repair genes. Cell repair genes are genes which will, all of us have cancerous activity. It starts in our cells as a aging phenomenon. And these cell repair genes will repair them. So you don't eventually end up getting a cancer. But when this cell
Okay.
repair gene is defective or has a mutation within it, that is when these people become high risk for breast cancer. So the breast cancer cell repair gene, if it is defective, then you become high risk for breast cancer. But not all those who have a family history have a gene mutation. This is something which is very important to be understood. So then why does it happen? It can happen because of a multiple reasons. It can happen because of unidentified inheritances. It can happen because of the same type of a constitution, physical constitution that women have tend to have as compared to their own mothers and sisters. It can also happen due to the same type of a lifestyle that most of us have in the same families. So there are multiple reasons which are known and unknown which can cause this. But the most important and significant reason that we are able to look at is probably the lifestyle related or the controllable factors which are there are what are very much responsible for the increasing number of cases that we are seeing in younger women.
Right. Okay. Okay.
Because the
Well,
genetic
what is
will affect
breast
the
cancer?
years.
Sorry,
Genetic
ma'am, I
factors
missed you.
genetic factors will affect all the ages, not
All the
necessarily
age
only.
groups. Right, right. It's not just for younger women or older women. It can affect anybody and at
Yeah.
any point of time. But again, one more new thing that I learned just now is that how our body has a natural mechanism to defend ourselves from cancer. And
Yeah.
only when that natural mechanism fails is when you are
Yeah.
going down
So
that path. Right.
this is a very unique mechanism which all of us need to understand who want to understand and protect ourselves from not just breast cancer but a lot of other preventable cancers. Our body functions in a very controlled manner. There are factors which will promote cell growth and there are factors which will inhibit cell growth. So this is so that we don't end up having injuries all over. You get a small wound, your body needs to fill it up. It needs to promote cell growth. तभी जाके वो जो जख्म हुआ है वो भरेगा. But all these factors also need to have an inhibition because if I have a wound today and if my body just keeps on putting scar tissue on it to heal it, one day will come when the scar tissue will be bigger than me. So that is where the body needs to have inhibitory
Right.
signals. So whenever there is a mismatch between these signals of growth versus signals of inhibition, is when someone would end up getting a cancer. And that is what explains what are those factors which are internal to your body which will cause problems and what are those factors which are external. For example, people who take tobacco in different forms are at a high risk of say lung cancer, oral cancer,
Right.
GI cancer. because that nicotine causes that damage. At some point, your body gives up trying to control that damage. Okay, the resources, so the stimulus to cause the damage
Right,
is
right,
much stronger than the efforts to control the damage. That's one example.
right, right. And that is due to repeated damage and repeated exposure to harmful substances or
Somebody who has a gene
carcinogenic
mutation,
substances.
yeah, somebody who has
Right.
a gene mutation may not have repeated stimulation, but they just have an inherent, deficiency of that power to fight against.
Right, right. Ma'am, my next question is about it's we'll go a little bit technical where we have talked about risk factors, we have talked about the symptoms. Those who are joining us real time, they can always go ahead or go back to the bits and pieces where we have talked about these issues. My next question is about breast cancer screening. या स्क्रीनिंग जिसे हम सरल भाषा में टेस्ट्स या डायग्नोसिस बोलते हैं तो ब्रेस्ट कैंसर किसी को है या नहीं वो डिसाइड करने के लिए आपके जो डॉक्टर्स हैं तो डॉक्टर्स क्या क्या अलग अलग किस्म के टेस्ट्स करते हैं टू कंफर्म और टू डिटरमिन दैट दिस पर्सन और दिस पेशेंट हैज़ कैंसर और नॉट एंड ऑल्सो ये कैंसर कितना बढ़ चुका है या कौन से स्टेज पे है.
Okay. So in your question, you used three words. Okay. You asked me about screening, you asked me about diagnosis, and you asked me about tests. All these three things, ये तीनों चीजें
Yes,
अलग है
three.
और इन तीनों चीजों के मायने अलग हैं. Tests, of course, are
Right.
procedures which we conduct to understand something related to the body. Screening and diagnosis are two different things. स्क्रीनिंग का मतलब होता है कि आज मुझे ब्रेस्ट में कोई तकलीफ नहीं है. इफ यू आस्क मी, मैम, डू यू हैव अ प्रॉब्लम इन योर ब्रेस्ट? नो, आई डोंट. आर योर ब्रेस्ट एब्सोल्युटली फाइन? एब्सोल्युटली फाइन. बट मुझे ये जानना है कि क्या आज मेरी ब्रेस्ट में कहीं पर कोई कैंसर या कैंसर जैसी चेंज है, या क्या अगले दो चार
Hmm.
सालों में मुझे कैंसर ब्रेस्ट होने की रिस्क है. जब मैं ये जानना चाहती हूँ और जब मेरे उसका प्रोसीजर हो, मतलब उसके लिए कोई प्रोसेस होता है, तो उसको स्क्रीनिंग कहा जाता है. So screening is done when you have no symptoms whatsoever related to breast cancer, but yet you want to know if your breast has any change in it which can be suggestive of a cancer, or does your breast have a risk identifiable which can put you at a risk of breast cancer in the near future. इसके अगेंस्ट जब हम डायग्नोसिस की बात करते हैं,
Okay.
डायग्नोसिस कम्स इनटू प्ले व्हेन यू हैव अ सिम्पटम. अ पेशेंट कम्स टू मी एंड सेज, डॉक्टर साहब, मेरे ब्रेस्ट में एक गठान है, क्या ये गठान कैंसर की हो सकती है? दैट इज व्हेन आई डू डायग्नोसिस. So the two different things, and they have two different procedures as far as breast is concerned. जब हम टेस्ट्स की बात करते हैं, so there are different
Right.
tests which can be used for establishing diagnosis in different organs. ब्रेस्ट की जब आप बात करते हैं तो ब्रेस्ट में जो कॉमनली यूज टेस्ट होते हैं उसमें होता है सोनोग्राफी ऑफ द ब्रेस्ट using sound waves, mammography of the breast using an X-ray. You can do a biopsy of the breast. You can do MRI of the breast, and there are many others which are very uncommonly used and which are not standard of care. नाउ हाउ डू यू यूज दैट? ये बात हम सभी को जानना बहुत ज्यादा जरूरी है कि हर एक व्यक्ति में मैमोग्राफी करने से फायदा नहीं होता है और हर एक व्यक्ति में मैमोग्राफी की जरूरत नहीं होती. परंतु
नहीं.
जब स्क्रीनिंग की बात होती है तो स्क्रीनिंग शुड नॉट बी डन एंड इज नॉट एडवोकेटेड टू बी डन इन एवरीबडी. स्क्रीनिंग तब करा जाता है जब अकॉर्डिंग टू हमारी पॉपुलेशन रिस्क. इन माय ओन कम्युनिटी, फॉर एग्जांपल इन इंडिया, इन आवर कम्युनिटी, if the risk of breast cancer is highest around 45 years of age, or the incidence of breast cancer that we see in Indian women is highest around the age of 45, then if I start screening my women from the age of 40, then there's a highest possibility that I will catch cancers in the earliest stage. But if
Okay.
my population has a highest incidence at the age of 45 and I start screening from 35, तो 35 से 40 का जो एज ग्रुप है, दे आर नॉट कंसिडर टू बी हाई रिस्क फॉर ब्रेस्ट. सो उनको
Okay.
अगर मैं सब्जेक्ट करती हूँ मैमोग्राम को, it's not going to give me much yield. And that is why in India, we advise that mammography based screening should be adopted from the age of 40. The second point in screening is that every woman does not need to undergo a mammogram every year. Which woman will require a mammogram every year versus which will require
Okay.
every 2 years or 3 years depends upon that first mammogram that she undergoes around the age of 40 or 40 above 40. So that is when the specialist will read the mammogram, either the radiologist or your breast surgeon, and define how high is your risk of getting a breast cancer, or how high is your risk of missing a breast cancer in subsequent examinations. There are certain types of breast जिसमें breast cancer miss भी हो सकता है, so we keep them also under supervision. So जब आपके doctors ये
Right.
risk evaluate करते हैं, then they will tell you that, look, you need to come back to me for a mammogram after 2 years, not before that. You need to come
Not
to
this.
me for a mammogram after 1 year or maybe 3 years. और different age group में ये different जो interval है ये अलग होता है. Between 40 to 50 अलग हो सकता है, 50 to 60 अलग हो सकता है, but it is a individualized difference. Everybody does not need to do a mammogram every year. Now, what happens if you want to screen for breast cancer under the age of 40? Now, screening according to our Indian, standards is not advised under the age of 40 because the incidence of breast cancer is still not that high that we can suggest community-based screening under the age of 40. But yes, individually, जो महिलाएं जिनकी रिस्क बहुत ज़्यादा हाई है, जिनकी फैमिली में म्यूटेशंस हैं, जिनकी फैमिली में 2 से ज़्यादा महिलाओं को यंगर एज में ब्रेस्ट कैंसर हुआ है, उनको हम ज़रूर सजेस्ट करते हैं that 5 years before the youngest age group that manifests in your family. जैसे अगर किसी फैमिली में 42 years of age में ब्रेस्ट कैंसर की केस हुई है, तो 5 years before that is around roughly around 37. The blood relatives, the female blood relatives of that patient should start investigating their breasts for breast. Now, under the age of 40, महिलाओं की breast बहुत dense होती है,
Right.
जिसका मतलब है कि on a mammography we may not be able to evaluate whether there is breast cancer or not. So that is why under the age of 40, we usually conduct a ultrasonography of the breast or a sonography of the breast as a first test of choice, followed by any other test as and when required. So under the age of 40, we don't advise mammogram unless we personally feel that there is a extremely high chance that this lady might be diagnosed, might have breast cancer, and only then. So nobody under the age of 40 should opt for a mammogram unless they have been evaluated by a specialist. And the reason for this is very simple.
Right.
Mammography is a radiological base test, and there is a risk of radiation hazard. So that is why it has to be optimized to achieve the best benefit risk ratio.
Right. Right. Um, I think it's a very clear definition जो आपने explain की है between screening, testing and diagnosis. And again, मैंने शायद शुरुआत में कहा था कि even younger women are getting affected with cancer, but the density or the amount of women suffering in younger age group is definitely lesser when you compare it with total number of cases and our overall population. So, of course, I think after 40, it is very important that you consult your doctor and at least every year you get yourself examined. Getting examined does not always mean getting a mammography done
Yeah.
because there are a lot of myths and related to mammography also. And that's how I'm coming to my next question कि mammography को लेकर mammography में भी तो एक्सरे होता है कि X-ray vision of your breasts. So is that going to be again carcinogenic or harmful for me or not? So how will you bust those myths which are related to mammography? Already clear कर दिया है कि unless and until a doctor asks you, you don't have to go and get your mammographies without any supervision or without any advice. So how do we correct those myths?
So there is a this is a very valid point. It's a very fine balance. Please understand that mammography is a radiation based examination. So there is certain amount of radiation exposure which is associated by doing a mammogram each time you undergo a mammogram. At the same time, you have to understand that there is a lot of radiation exposure that we undergo in our day to day lives unknowingly, inadvertently. So, when it comes to doing a mammogram, what we need to understand is that under the age of 40, mammography should not be done unless it is advised by a specialist. The radiation exposure which is associated with mammography is not very significant. However, there have been studies in the past which show, and where this confusion came from was because of a few newspaper articles which keep following that study, that mammography in fact increases the risk of getting breast cancer. Now, please understand,
Right.
this was a very specific study, and this study was exclusively done in those women who are already at a very high risk of breast cancer due to the presence of some mutation or some physical finding in their breast. And in these women, it was ascertained that if mammography is done more than annually for a period which was over 5 to 10 years, then there is a marginal increase in their risk of breast cancer. This study does not apply to normal women. This study does not apply to women who do not do frequent unwarranted mammograms. Again, a mammogram which is done at a right time, at a most eligible age, and under medical supervision, has more benefits than harm, and can be not only life changing but can be breast saving in certain circumstances. So that is why, yes, it should not be done injudiciously. It should not be repeated unless a specialist asks you to repeat it. And definitely, there is a very, very, very limited role for mammography under the age of 40. So, the best way to tackle the elephant in the room is by not doing mammograms injudiciously, but doing them as per the advice of a specialist who can ascertain how high is your risk of getting breast cancer and accordingly advise you at what intervals you need to get your mammograms.
It should cover a lot of myths that we have. And हम भी सारे आर्टिकल्स और ब्लॉग्स पढ़ रहे होते हैं जिसमें हम पूरा कॉन्टेक्स्ट समझते नहीं है या सिर्फ टाइटल पढ़ के एक ओपिनियन फॉर्म कर लेते हैं एंड वी थिंक दैट दैट्स द फैक्ट नाउ ओके वी डोंट हैव टू नो थिंग्स अराउंड इट और हम एक ओपिनियन बना लेते हैं सो आई थिंक वी are very clear on how and when mammography should be done and very openly speak to your doctor about it. I think doctor, we are now coming a
Thank
little bit towards the end of this conversation, and I always like to end the talk on a high note. So, अभी तक हमने काफ़ी सीरियस बातें कर ली and we spoke about fatality, about risk factors, symptoms, and screening, etc. What are your success stories? So you've been practicing since I think almost 2 decades now. So जिसमें it has been either challenging for you as a doctor to tackle that or आपका जो patient है उसकी इतनी exemplary उसने हिम्मत बताई हो
uh,
कि
so
उसकी
yes, you have
family ने
very
exemplary
rightly said.
support दिखाया हो something which encourages those people.
Yeah. So let me tell you, this over the last 3 decades, I have seen a vast variation in not just the presentation of breast cancer, not just the management of breast cancer, but how women have responded to breast cancer. And I can tell you, I am one proud woman before I can say I am a proud doctor, because the way women have changed their outlook and the way women have taken control of their circumstances is something that makes me extremely proud to be a woman in this country of mine. And one of the best changes that I have seen in the society is that now women come and ask for their options, and that is what I would still like to, emphasis on. Please, whenever you are diagnosed with breast cancer, ask for your options, ask for your alternatives. What are my options? What are the alternatives that are available to me? And what are the other perspectives of my care? And if I tell you a very good example, like you asked me for example, I have a patient whom I treated when she was in her 50s. And at that point of time, I had counseled her that, there is a possibility that this might be a genetic mutation and you have family history. So your daughter needs to be aware and we should test you for, a genetic mutation. But at that time, they thought that, no, we don't want this type of a labeling that we have a mutation in the family. And they were scared of that, what will happen. At that point of time, her daughter was quite young, and I think she was in her early 20s. But she used to listen to these conversations and she was aware of it. So when she was 25 and she got diagnosed, she had a lump in her breast. She didn't waste any time. She, at that point of time, was engaged with a young fellow, and she just came to me and she said that, look, doc, this is what has happened. And I think looking at my history, the way you have told me, this may be breast cancer, so let's get done with it. And she was so well planned, she was so ready for it with her questions. She had done her homework, she had come to me with my her questions. I am a 25-year-old, I'm yet to get married, I'm yet to have my pregnancies. I would like to know what are my chances of having pregnancies in the future. I don't want my breast removed, but if I have a genetic mutation, I need my breast removed. So what can you do about it? Can you save my breast? Can you save my nipple? Can you save the skin of my breast? Wonderful response. So controlled. And her fiance, so much a part of her decision making process and so much in support to her. Neither trying to influence a decision nor trying to, say that this is not my take, this is yours. No, very supportive, discussing it out with each other. And she has had such a beautiful recovery. She underwent chemotherapy. Before starting her chemotherapy, she underwent a fertility preservation procedure, so that in the future they can still have you know a chance at having their own children. And then she went on to have a nipple and areola and skin saving surgery with a reconstruction. So right now she is, completed her treatment. She finished her post graduation, which she was trying to, complete at that point of time. She's, got a new job and doing so well, and all this while getting treated. So there are so many such stories now that previously I used to, really had to look for such cases which made me feel happy and which made me feel good that I, was able to give them the care that they deserve. But now more and more, and it's more than my doing, it's their doing. These younger women, they are so well read and they are so, I guess they are so aware of what is happening. That's a very good thing to understand. And this is
In
something which I
control
need to
of their decisions. Yeah.
in control of their decision. And you need to be ready to own up to your decisions. So once you're ready to own up to your decision, it doesn't become very difficult because it's your life,
Right.
it's your body image, and you should be taking decisions related to that yourself. Of course, with the help of your surgeon, ask him what are the options, how can this be done, can I do this, can I do that. So the biggest thing that I've seen happens is once you're faced with the diagnosis of cancer, there is this emergency situation. There is this college karina. I have patients, relatives who come and say that, no, no, we don't want to wait. Just finish it off tomorrow. No, it's not like that. That is not the level of emergency in breast cancer. In fact, in breast cancer, it is much better to take a couple of days, to take a few days, reach a perfect diagnosis, understand what are your options, understand what are the different perspectives of your treatment, and then start your treatment.
Options.
That is when, because it's not just important to treat somebody from cancer, to save somebody from cancer, but for me as a breast surgeon, it is equally important to try and see if I can save her breast. And if I can't save her breast, can I save her breast form? And once I have done all this, once I have finished her treatment, once I have finished her surgery, I should be able to put her back in the society as the person that she was. And that is the most important aspect of your
Right.
treatment plans.
Right. Shift that has happened among women also, where we talk about empowerment. So empowerment क्या होती है? The ability of of taking your own decisions or educating yourself with what options you have, educating yourself about your own body, and then making an
Yes.
informed decision. यही तो एम्पावरमेंट
Yes.
का बहुत बड़ा और I think I would like to just pick one particular nuance from your answer. You said about breast restoration at while you were talking about this patient's story. So I'm sure a lot of our viewers would be interested to know what women's body about for their femininity. Of course, women who are still in their reproductive age group, for them it's about their pregnancy, fertility, ability to breastfeed their child. So ब्रेस्ट कैंसर को लेके जो एक और एक फियर वो ये होता है, व्हाट इफ यू लूज योर ब्रेस्ट completely, or how will I look after that, or how will I be able to bear children? Will everything be normal for me? So can you just shed a little light on that,
Yeah.
so that people
So
don't, who are
every
scared, they get at least like a 0.5% idea of it?
Right. So every young person who wants to preserve her capacity of conceiving in future now has a lot of medical and surgical options of preserving fertility, and they are very much available in our own city also. So the only thing that needs to be done is she needs to ask it to her medical oncologist, and along with the team who is going to do the fertility preservation, opt for it. So it's very much doable. So as far as fertility preservation is concerned, yes, it is possible, and yes, they should opt for it. There are quite a few ways that it can be done, and your medical oncologist or your surgeon will be able to explain that to you in detail. It can very much be done. As far as saving the breast is concerned, whenever breast cancer is treated or diagnosed and treated at an early stage, then saving the breast is much more easier than saving the breast at a later stage. So when somebody comes to me at a later stage, saving the breast becomes a little difficult. But now we even have options for that. We can give what is called as neoadjuvant therapy and make the breast more accessible or more ready for breast saving procedures. Now, unfortunately, there are a lot of women in whom, due to the nature of the cancer or the nature of the breast parenchyma or the breast tissue, saving the breast is not an option. So, in that scenario, what we can do is we, as
Okay.
surgeons, perform what is called as a skin and nipple saving mastectomy. So, where the affected gland of the breast is removed, but the shape of the breast, along with her own skin, her own nipple and areola, are preserved. So, by a cosmetic oncoplastic procedure, the breast is removed and it is substituted by her own tissues or by implants to give her a breast form, what is called as a breast form. So that is very much possible. And in fact, it is every woman's right. Every woman deserves to preserve her breast, or at least if the breast cannot be preserved due to some medical reasons, then to preserve the breast
Right.
form. Very much possible, and every woman should ask for.
So we have one question in our DM which is asked to you, that you mentioned earlier in your talk that pregnancy at later stage can also be one of the external reasons for getting breast cancer. For our viewers, can be the reason, also one of the risk factors for breast cancer. So now that a lot of females are conceiving little later in their life, like initially they used to conceive somewhere between 17 to 25, and after 25, after 30, a lot of them are 40 and still conceiving. So due to career, or due to finding right partner or studies or many other reasons. So
Hmm.
What would be your advice in that sense, or how is the risk percentage in it?
Uh, this is a very personal decision for every woman. Being a professional woman myself, I know how difficult it is to really achieve the right balance and, plan your pregnancies and your family and your child rearing along with your career and along with your education. I would have only one advice for all the young women who are, on the brink of their career and who want to understand what to do is take informed decisions. Be aware of your own circumstances. Be aware of how well prepared you are for handling a pregnancy and then take a decision regarding the pregnancy. Biologically, yes, it is advisable that you should plan your first pregnancy ahead of 32 years of age, was what previously used to be said. But yes, somewhere between 26 to 32 should ideally be your first pregnancy. Not just because your body needs it and your body will have a better response when you do that, because that's the age when you will be able to give your child a much better, you will be able to experience a much better motherhood, but also you will minimize your risk of breast cancer. But this is a very individual and a very personal decision. It does not mean that those women who have children at a later age are not able to take care of their children.
Right.
They're very much, and they also, we've had so many examples of exemplary mothers at that age also. So then what does that leave us with? That leaves us with a decision that yes, due to my circumstances, I'm going to have a child later in my age. So there you need to be aware your risk of increased risk of breast cancer, and
Hmm.
you should screen your breast more regularly and keep checking your breast regularly. Anybody who is probably going to conceive after the age of 35 should make sure that before they plan a pregnancy, they should get their breasts examined by a specialist, and they should know that their breasts are absolutely normal to begin with, and then go ahead and plan their pregnancy.
We have one more question in our DM. This question age and what she's trying to or 54. How frequently should you go and get yourself examined? Also, there is a lot of fear every time when they go for such checkups. So, how to tackle? And I think that's why I have also picked this question, is because fear is a huge reason why people don't want to go to a doctor, or why they don't want to take a step and just say that okay, I'm suffering from this. क्योंकि हमेशा उन्हें ये लगता है कि कुछ बड़ा निकल आया तो, या कोई सीरियस बीमारी निकल आई तो. So, as a doctor,
So,
how do you tackle it? Like, I think you have already answered the first part of question, that every year you should go and get regularly screened. But what about the fear part?
uh, so every year, every woman should go and get her breasts clinically examined by a doctor, and according to her base mammogram, which is done at the age of 40 or around 40, her doctor will be able to tell her how frequently she should go for a next mammogram. When we talk about fear, what if I have cancer? Then what will happen? The best example of this is my half glass half full or half empty. It's about looking at the second side of the coin. When I sit in my breast cancer OPD and see
Yeah.
100 women with known symptoms of breast cancer, known signs that, doc, I have a lump, even in those women out of 100, hardly 12 to 15 of them get diagnosed with breast cancer. The remaining around 80 to 85% will get diagnosed with non cancerous diseases, non cancerous conditions, and most of them will get diagnosed with what are called as benign conditions, which may require no intervention at all. So, this is where I'm talking about symptomatic women. So when I talk about asymptomatic women who have no complaints but are going to screen themselves for breast cancer, the possibility of you having a normal mammogram is much, 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 much higher than you having an abnormal mammogram. And God forbid, if somebody gets an abnormal mammogram, please understand, when you have an abnormal mammogram, when you have no symptom, it is very unlikely that your cancer is beyond stage 1. And at stage 1, breast cancer is 100% curable. Most stage 1 cancers will not
Right.
require breast removing surgeries, and most breast stage 1 breast cancers may not require chemotherapy. So look at the other side of the coin.
Right.
Even if somebody is getting diagnosed on a screening mammogram, that somebody has got the best way of managing her breast cancer. If that screening mammogram was not done, by the time you developed
True.
symptoms and came to me, this cancer would have progressed to stage 2, stage 3, and God forbid, sometimes even stage 4.
Right, right. Regular screening cannot be ruled out. Early stage detection में आपके breast skin और आपकी nipples भी save हो सकते हैं. Also, you don't have to go for a very aggressive treatment or cycles of chemotherapy or radiation therapy. I think that early cancer detection would save lives. जिन लोगों ने ये वीडियो देखा है, thank you so much for joining us and for listening to what ma'am had to say, and we had to say, and we had to present it to all of you. If you have any questions any time when you're watching it on any platform, please leave your queries, and I'm sure ma'am will be very kind to answer them, or we'll get those answered and share with you in your DMs. We understand that the nature of this conversation is very intimate. So it's very difficult for a lot of women to post their queries in the comment sections directly. And that's why we're getting questions in DMs or in on WhatsApp पे या पेज के DM में भी इसको डाल सकते हैं आपके questions, and we will definitely try our best to get back to you. However, most of our questions related to breast cancer awareness have been beautifully covered by Priyanka for joining us for this talk, for spending almost an hour with us, and giving us wonderful wisdom regarding this subject. And we are definitely in it. Thank you so much, ma'am.
Thank you. Thank you, Kritika, for being so patient with me.
Thank you. So with this, we end this live. जो भी अपने काम का लगे बीच बीच से देख लेना, but please do check out our video. If you have any questions, please just put it in the comment section or in the DM. Thank you all.
And please remember to
Bye
examine your
bye.
own breasts.
Yes, yes.